Sorry. No, you're right here on time. The Health Service System Governance Committee meeting shall come to order. And let's go with roll call.
Call to order at 9:02 a.m. and agenda item number 2 is roll call, starting with Committee Chair Zavansky,
Here.
Commissioner Howell,
Present.
and Commissioner Wilson.
Here.
With that, we have quorum.
Good, thank you. That's always good to know. And now for item number 3, please.
Agenda item number 3, general public comment. This is an opportunity for members of the public to comment on any matter within the board's jurisdiction that is not on the agenda, including requesting that the board place a matter on a future agenda item. And I'll read our public comment instructions. Remote viewing today is available on WebEx online. The Health Service Board welcomes public participation during public comment periods. There's an opportunity for the general public to comment at the beginning of the meeting on this agenda item, as well as an opportunity on each agenda item. In-person public comment will be first, then remote public comment. For anyone waiting in person, you're welcome to approach the podium. Each speaker will be allowed 3 minutes to comment in length until the board chair deems new public time limits during the meeting. All but public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. The Health Service Board will hear up to 30 minutes of remote public comment total for each agenda item. Remote public comments from people who have received an accommodation due to a disability will not count toward the 30-minute limit. Members of the public attending the meeting via phone can dial in by calling 415-655-0001 and enter access code 2664-619-5750. When prompted, press pound. You'll be prompted to enter the webinar password 1145, then press pound again. Press *3 to be added to the public comment queue, and you will hear the prompt, you have raised your hand to ask a question. Please wait to speak until the host calls on you. When the message says your line has been unmuted, this is your time to speak. You'll be muted when your time is expired. For those watching the meeting on WebEx, click on the raise hand icon to be placed in the queue to speak. A raised hand will appear next to your name. When you're unmuted in the system, a request to unmute will appear on your screen. Please select the unmute to speak. Once you hear welcome caller, you can begin speaking. When your time is expired, you'll be muted, and please click on the raise hand icon to lower your hand. Members of the public are encouraged to state their name clearly, although they may remain anonymous. I'll give an audible warning when your 30 seconds are remaining, and when the 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and I'll unmute the next caller. We'll begin with any in-person public comment. No one has approached the podium.
Is that Fred coming forward? Got to be quick, Fred.
Good morning, Fred Sanchez with Protect Our Benefits. I know we're going through a transition period, obviously, and one of the things I wanted to say, and I've been assured by HSF staff that they're looking into it. They've heard the same things, and they have records. People calling into the Blue Shield number, trying to get information, have been put on hold only to wait maybe 15 minutes, and suddenly it comes off that we can don't hear it now or call back later, we can't get to you. This is kind of disturbing, but I've been assured by HSF that they've heard the same things and they have the call records. So then we'll have a factual whether or not this is just an anomaly that happens once or twice, or this is something that's more serious. So thank you for your staff. And then they also have assured me that they're looking into the relationship between John Muir Medical Center and Blue Shield, and that they've heard a couple things about that, but they're looking into that as we speak. So thank you for that. That's all for now.
Thank you. We'll now move to our remote public comment, and our moderator will notify us of any callers in the public comment queue at this time.
Board Secretary, we have 2 callers on the phone line. 0 callers have entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed.
Okay, thank you. And now let's move to item number 4.
Agenda item number 4, review and approve the Health Service Board Contingency Reserve Policy 210 revisions. This is an action item and will be presented by Mike Clark with AI.
Good morning, Mike.
Good morning, Commissioners. Hope everybody's well today. Today picks up from a conversation that was had back in the spring about the contingency reserves, modifying the contingency reserves, which happened on a one-time basis at the time. Today's proposal is to basically remove the active dental PPO plan from the contingency policy. So we'll talk through the basis for those modifications, the policy itself, what's being modified, and the rationale for removing the dental plan, leading to the recommendation for action today.
Great.
So just a refresher, at the March Health Service Board meeting, we presented suggestions to modify the contingency reserve amounts that had been set as of June 30th, 2023 for the self-funded and flex-funded medical plans and dental plan offered by San Francisco Health Service System to address unprecedented near-term adverse financial outlooks. And those approved one-time modifications involved reframing the medical contingency reserves to, and again, technical term here, but the 95th percentile confidence level, which was within the policy 210 framework. So we're not addressing any of that today. But the other was to set the active dental PPO contingency reserve to 0, which led to lower calendar year 2025 budget forecasts for the health plans that would have occurred had the contingency reserve levels that were approved at the January meeting continued. So during this meeting, that was approved. Today's presentation and request for approval is the first step in the process of removing dental, as we talked about in the March meeting, from policy 210. And if approved by the governance committee today, this request for approval will go to the full Health Service Board at next Thursday's meeting. So just some background on the policy. The contingency policy is one of 3 reserve policies that are set by the Health Service Board. And again, we emphasize 210 because that's the focus today, but along with the stabilization rate policy and the incurred but not reported reserve policy, make up the 3 reserve policies from the board. The contingency reserve can be thought of as an emergency trust fund that was first implemented by SFHSS in 2007. It protects the trust from highly unusual, adverse, high health plan claim experience that could be included. And you can see some of the factors that could enter into why there could be adverse claim experience for a health plan. So no question, it's prudent for a self-funded and flex-funded health plan to have a contingency reserve for the medical plans to absorb that financial strain that could be brought by adverse claim experience. They allow SFHSS to establish a budget, based on a predetermined funding level. And as stated in the policy itself, having this reserve serves the same purpose as external stop loss for medical plans. And so therefore, external stop loss would not be purchased, though Blue Shield of California does require large claim pooling for its HMO plans. So for today, the policy covers the flex-funded HMO plans, the non-capitated costs, the self-funded PPO plan, and the self-funded active dental PPO plan. That is what's proposed for elimination from the policy today. And there is further information in the appendix, should you be interested. And so, kind of refreshing some of the conversation we had back in March, the contingency reserve, again, is prudent for the medical plans. But for medical plans, the member financial responsibility on high cost claims is capped through the plan out-of-pocket maximums. So those costs that exceed out-of-pocket maximums for the medical plans go to the plan, not the member. For dental, the plan's financial responsibility per member is capped through the plan annual maximums and lifetime orthodontic maximums, where you can see the amounts that are in place today for the active dental PPO plan. So when we study the contingency reserve policy and the rationales presented within for why have a contingency reserve, the dental plan contingency elements really don't apply. Though historically the reserve policy has included provision for the active employee self-funded dental PPO plan. Namely, dental plan experience has historically not been subject to random variation from expected claims. There is definitely full credibility when you look at over 30,000 covered employees and 70,000 covered lives. The benefit maximums control any potential for large claim experience. And I think most notably, catastrophic events historically don't alter the course of a dental plan. For instance, when we had the COVID-19 pandemic, people didn't rush out and get dental services. In fact, it was difficult to get a dentist that would be open for an appointment. So, the criteria for a contingency policy that are extremely prudent on a medical and prescription drug plan just don't apply to a dental plan. So as a result of the prior SFHSS and AN review of the contingency reserve modifications of the March 2024 meeting, it is recommended that the active dental PPO plan contingency reserve be eliminated from the policy itself. And I know that you've been provided with the specific language changes to policy 210 that would remove the 2 instances of dental mentioned in the current policy. So I'll close. With that is recommended that the governance committee of the Health Service Board approve today's recommendation to adopt the proposed language modifications within Health Service Board contingency policy, reserve policy 210 that would remove the active dental PPO plan from policy 210. And if approved today by the governance committee, this proposed action would be taken for review and approval by the full Health Service Board at the December 12th, 2024 meeting.
Thank you. I'll entertain a motion for this recommendation.
I move that we approve the recommendation to adopt the proposed language modifications with HSB contingency reserve policy 210 that will remove the active dental PPO plan from policy 210.
Second.
Thank you. It's been moved and seconded. Thank you very much. Is there any discussion from members of the board?
No.
Hearing none. You made a good presentation. We've got that. All right, and let's take the vote.
Public comment.
Oh, excuse me, public comment first.
Thank you.
Fred, I see you back there.
We'll begin with our in-person public comment.
Once again, Fred Sanchez from Protect Our Benefits. I know this has been continued since March 14th, and it's just been brought to my attention that if it's been continued that long, why couldn't it be continued one more month until the new administration understands this more fully? And that's what we're asking, that it just be continued, this motion, until January, because there's going to be a change with the new elected mayor coming in, so that his people have an opportunity to be brought up to speed on why this is something that's necessary. Because if it's been continued, like just about 9 months, would 1 month more make a difference? Thank you.
Thank you.
Remote public comment is available. For those callers on the line, press *3 to be added to the public comment queue. For those watching the meeting on WebEx, click on the raise hand icon to be placed in the public comment queue to speak. We'll look to our moderator to notify us of any callers in the public comment queue at this time.
Board Secretary, we have 4 callers on the phone line. 0 callers have entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed.
Thank you. Fred, you have something to add?
Yeah, I just got a phone call from 2 different people saying that they cannot get into WebEx, that there's a problem with the phone lines. So I just bringing that to your attention.
Thank you. I can see from my moderator that we do have 4 guests on the line. I can look into any challenges that we may be having. It does look like though it's coming through on WebEx to be able to hear and see us. The phone lines is something I'll check.
Okay. Is anyone coming forward to speak?
No, I cannot see from our end, and the moderator can let me know, but there are no raised hands,
Okay.
which may be the issue that's coming up.
Tony Fazio, one of those individuals.
I can't reveal who's on
Okay,
the,
all right, but he's called.
but there are 4 callers, as the moderator has said. So, Chair, I'll look into.
Okay, yeah, because I'm thinking, does Tony have does he want to speak?
Yes.
Oh, he does. Okay.
Which is
let-
why I'll
let's-
check into the tech side.
Yeah,
Yeah.
let's see what's
Okay.
going on. We'll give it a minute.
It may take more than a minute. Would it be prudent to be able to bring back public comment at another point so that
Could do that.
the agenda can move?
Yep,
Okay.
actually,
And would you want to wait to take action or?
we could, yeah, we would hold action
Okay.
until final public comment is done. Because we know there's someone who's specifically wanting to speak.
And let's,
Mhm.
from my position, I always want to check in with the city attorney. Would that be permissible?
And chair can move the agenda items around, so if you want to move it to later.
Oh, okay, that we could wait and,
I'm sorry, are you talking about just taking a break?
no, I don't think we're talking about taking a break. No, we could go forward. But if there is, because public comment would not be done, we would have someone who's waiting to speak and can't get in. And so we can't take our vote until we have,
Well, the language in the, I believe if it's the same language we've used, if we have, we do our best to provide public comment,
Mhm.
but if there is a technical issue, it says that you may not have remote public comment.
oh, that we may not have a public comment.
Yes, we do put that on our agenda and the
Yeah.
website so that public comment is guaranteed in person, but due to a technical difficulty, it may not be available,
Okay.
which my
Mhm.
understanding is that action can still be taken. Public comment was available, as long as we do our best ability to fix any glitch that we can.
Okay, and is somebody working on this glitch?
I can, as we move on, I can work from the back end.
Check it out,
Yeah.
great,
Mhm.
okay. Thank you. Then
I
let-
mean, there would be, am I right in thinking there would be a possibility you take a vote now? This just takes it to the board next week. So
Right.
there is room
not
to have
final.
public comment next week if we can't fix the glitch. We don't, the train can keep moving.
That would be fine.
Yeah,
Today's actions are recommendations from the committee to the full board. So
Right.
They will be heard again at the full
Right.
committee.
exactly.
Full
No,
board meeting.
so another opportunity. Our vote isn't final today by any means.
Right, correct.
Okay, because if we can't clear up the glitch, then let's go ahead and, do we want to take action? Okay, I will call for a vote on the governance committee approving today's recommendation to adopt the proposed language modifications within our contingency reserve policy 210 that will remove the active dental PPO plan from policy 210. Is there any further discussion from any board members? Hearing none, let's take a vote.
A roll call vote, starting with Chair Zamansky,
Aye.
Commissioner Howe,
Aye.
and Commissioner Wilson.
Aye.
So it is unanimous. Okay. But again, this will come back before us later if we need to make any modifications. Okay. And I think, am I right that that concludes item number 4? Good. Okay, moving on to item number 5.
Agenda item number 5, review and approve the SFHSS rules and section 125 cafeteria plan for plan year 2025 revisions. This is an action item and will be presented by Olga Stavinskaya Velasquez, SFHSS Operations Manager.
Welcome.
Good morning, Commissioners. Olga Stavinska Velasquez, Operations Manager, Health Service System. Today, we will review the purpose of the Health Service System's governing rules, which include the cafeteria plan and its key requirements, and the San Francisco Health Service System rules. We will then review the proposed changes for both the San Francisco Health Service rules and the cafeteria plan for plan year 2025.
Okay.
The cafeteria plan is a program that employers can use to help employees pay with certain expenses like health insurance and dependent care with pre-tax dollars. Because taxes play a key role in the cafeteria plan, this type of plan is governed by the Internal Revenue Code. It is sometimes referred to as Section 125 plan because of because the rules are found in Section 125 of the Internal Revenue Code. Contributions to the cafeteria plan are withheld on a pre-tax basis, thereby lowering the taxable income of participating employees, which means employees pay less in federal income tax, including Medicare and Social Security. The tax savings for employees through the use of pre-tax dollars to pay for benefits can be substantial. Non-compliance with the requirements of Section 125 would risk approximately $263,401,792 in pre-tax dollars for 2024.
Is that that would be our risk?
That's correct. Failure to comply with the cafeteria plan would risk that amount. Yes.
Okay.
So as an example, an employee who spends $200 a month on pre-tax dollars for benefits can in effect save $60, assuming a 30% tax bracket, 30% tax on those $200 would have gone to federal, state, or income tax, including Medicare and Social Security.
Okay.
Because of the tax favored treatment when sponsoring a cafeteria plan for employees, Section 125 prescribes multiple rules that employers must comply with. Three main requirements are plan documents, irrevocable elections, and non-discrimination. Employers are required to create and maintain certain plan documents that are designed to ensure that its cafeteria plan is compliant with applicable laws and regulations, including the benefits that are offered, who is eligible to participate, the manner of the contributions, and other legal notices. This must be adopted by valid board resolution and is amended in the same way. This is an annual process that we go through. Employers must ensure that the rules are outlined in the plan documents and are followed. Since there is no correction program, failure to administer a plan in accordance with the written terms of the plan and the Internal Revenue Code could lead to potential full loss of the tax advantage status for all employees. A cafeteria plan must provide that participant elections are irrevocable and cannot be changed during the coverage period, generally the 12-month plan year. This is known as the irrevocability requirement. However, employers may allow participants to change their elections during the plan year if those employees experience events that fit within several exemptions recognized by the IRS, and these are called qualifying life events. The Internal Revenue Code prohibits employers from favoring highly compensated individuals and key employees when it comes to eligibility benefits and utilization under the plan. In general, annual non-discrimination tests are required to ensure compliance. If a cafeteria plan fails any of the non-discrimination tests, then the highly compensated participants and/or key employees will lose tax-free status provided by the cafeteria plan. The San Francisco Health Service Rules, or SFHSS rules, are designed to provide clear structure and framework for managing the health benefits offered to eligible members and dependents. These rules have been adopted by the San Francisco Health Service Board, consistent with local, state, and federal regulations. And again, we go through this process annually. These rules serve to ensure equitable access to healthcare coverage by defining eligibility criteria, enrollment processes, and the scope of benefits available. They also establish guidelines for appeals and compliance with relevant regulations in the administration of health benefits. I do apologize. I have one slide out of order, so we're just going to skip to the next slide here.
Okay.
Before we make our recommendations for the changes to the SFHSS rules and the cafeteria plan, I would like to preface that minor changes in formatting and edits for readability have been added throughout both of the documents. However, they are not going to be listed in the summary in the next several slides, but they are available for you in the full red line documents. And this does apply to both the cafeteria plan and the SFHSS rules. So we'll start with our recommendations for the SFHSS rules for plan year 2025. We have added a paragraph to the beginning of the rules to provide the to illustrate the rule's purpose, as it had not been included in the document previously. In the next 10 slides, you will see the summary of the recommendations we are making to the changes in the SFHSS rules. If there are any questions, I'm happy to entertain, we can go through each one individually.
Any questions? No. Any issues? Carry on. Go ahead. Sorry. Thank you.
So then the next 10 slides do illustrate the summary of the rules that we're recommending, and then it is followed by the cafeteria plan recommendations. Those are standard annual changes. We're moving the FSA contributions to align with the IRS regulations from 2024, increasing the contribution for healthcare savings account to $3,200 from $3,050, and increasing the rollover amount from $610 to $640. And then we're also aligning the flexible credits for our CCSF and court employees who are eligible for those credits to those that are approved through their respective MOUs, along with making changes for the available plans for plan year 2025, which is Appendix E of the cafeteria plan. It is the HSS recommendation that the board approve the rule updates for plan year 2025, along with the cafeteria plan updates for plan year 2025.
Thank you. I have to keep reminding myself it's 2025 we're looking at.
Just a couple of weeks.
Yeah. Okay. Go ahead.
Thank you very much. That concludes
it?
the presentation. If you have any questions, happy
Any
to answer.
questions? Issues, questions? Nope. Very good presentation. Thank you very much. Okay, so now are we looking at our rules and see if we have to take a vote on these?
Or move to the proposed, the recommendation slide,
I'm sorry.
the recommendation slide.
So the recommendations are all, the 10 next slides are the full recommendations. There, I apologize, there's a couple of them, so they're not all in one document, or one slide.
Oh, so it's
Visually.
all of-
Correct, it's the next 10 slides are the recommendations. If the board wants, we can go through each one, but I know you all had an opportunity to take a look at the red line version as well for full understanding of the changes.
I guess that's what I'm looking for is to pull out where the language is being changed.
That's
Well, it's
in
on all
the-
10 slides, but I think if we
Right.
just ask for approval of the rules and section, of the
Right.
cafeteria plan, I think that would
Okay.
suffice.
Oh, okay, so number 5. Isn't that what we're in? We're in number 5, okay?
Yes, we are on agenda number 5.
Okay, so we have to approve the health service rules and section 125 cafeteria plan rules. So, and that's what we have before us. Are there any questions?
No.
Comments? Do we want to take a roll call vote then on
I
that?
think can I move to
Motion.
approve?
Yes.
I would move to approve the SFHSS rules and section for 125 cafeteria plan for the revisions for 2025. as
Second.
reviewed.
It's moved and seconded. Okay, is there any further discussion? Any comments? Seeing none, let's take the vote.
Public comment?
And Chair, I have
Public
been
comment.
working with our public comment, our facilities to do the public comment, and I can see hands raised now.
And I see someone standing now. So
So-
we've got someone. All right, sorry to.
I'll continue to work with our media services through this public comment, but we'll begin with in-person public comment.
Mhm.
So for those in person, you can approach the podium, and then we'll be followed by remote public comment. For those callers on the line, press *3 to be added to the public comment queue. And the instructions are displayed on our agenda. There's an access code and a meeting ID to be prompted into the phone service. So for those watching on WebEx, make sure to click on the raise hand icon to be placed in the public comment queue to speak, and press *3 to be added to the public comment queue if you're on the phone. We'll begin with any in-person public comment.
Welcome, Mr. Fred Sanchez.
Fred Sanchez, President, Protect Our Benefits. I'm curious if there's a deadline on this, like it's got to be acted within a certain period of time, because it appears like these are clarifications to the benefits of the members. So it seems kind of almost routine, but once again, with the change of administration, it would seem it'd be appropriate that if there isn't a deadline, that it's got to be acted on by the 12th, that it could be carried over to the January meeting. That's all. If somebody can answer, is there an actual deadline that it's got to be acted on?
Yes, it's for plan year 2025. Yes, it has to be approved in order to be effective on January 1.
Thank you.
With no other in-person public comment, we'll move to our remote public comment, and our moderator will notify us of any callers in the public comment queue at this time.
Board Secretary, we have 6 callers on the phone line. 1 caller has entered the public comment queue at this time. That caller has just dropped off the phone line.
Oh. That most likely was our web services who was checking.
Mm.
So thank you, moderator. Here,
You're welcome.
seeing no more raised hands, we'll close public comment.
Thank you. Seeing none, public comment is in fact closed. And now
Moving to our action.
we can take our action. Okay, I'll entertain a motion.
It's just
Or
a
repeat
vote
the
now. We
motion.
did the motion. I
We
think
did
we're
the
okay.
motion, yes. I was going to say repeat the motion.
So
Do we
starting
need
with
to repeat we should repeat the motion.
the motion has been stated. I can do a roll call vote.
Okay.
A roll
Forward.
call vote, starting with Chair Zavansky,
Aye.
Commissioner Howe,
Aye.
and Commissioner Wilson.
Aye.
A unanimous.
Right.
Vote.
Okay, great. Just making note in my notes. Thank you very much. Go ahead, and now let's get to item number 6.
Agenda item number 6 is initiate the public employee evaluation of the SFHSS Executive Director for plan year 2025. This is an action item, and I'll be moving to the podium to present.
Okay.
Good morning, Holly Lopez, the Board Secretary. The Health Service Board terms of reference and policies outline that the Governance Committee coordinate the Board annual SFHSS Executive Director Performance Evaluation. I come before the Board today, the committee, to present the materials so that the committee can initiate the annual performance evaluation. The committee shall recommend to the full board the criteria to be used for the performance of the executive director, and shall have the opportunity to approve any edits in the evaluation tools and the timeline to administer the evaluation. Today, the committee will have the opportunity to review that evaluation tool and the implementation timeline. The recommended changes will go before the full board next week at the December 12th full board meeting for final approval. As in past years, the administration, once approved, the board secretary, myself, will administer the evaluation, collect the evaluation results, analyze the data, compile a report, and present the report to the committee first, and then to the full board. So the 2 materials that we'll review today are the evaluation tool and the suggested implementation timeline. So I'll begin with the evaluation tool, just an overview, and then I can take any notes of suggestions or changes. So as set out in policy 204, the board members are expected to complete the evaluation, which is designed to allow the board members and the designated staff to assess the qualitative aspects of the director's performance. The reporting period is January through December of 2024. The evaluation addresses the 5 following areas: leadership and vision, second, resource management and governance, third, management of people, fourth, collaboration and communication, and the last area is the client service focus. There is a 5-point rating scale ranging from exceptional performance to unsatisfactory performance. There are 5 questions or areas addressed. Each question requires a rated point. If a board member selects a 1, 2, 4, or 5, the board member is required to provide supporting comments. A 3 rating does not require a comment. The Health Service Board Commissioners, the San Francisco Chief Health Service System Chief Financial Officer, and the Chief Operating Officer complete the survey. And accompanying the evaluation will be a report from the Executive Director containing their self-assessment and any supporting information or documentation that the Executive Director believes may be of value to the board members in completing the evaluation. So with that, I can move on to the timeline, or we can look through that section and I can take notes on changes. What's your preference?
Is there any comments?
I think my only question is this similar format to prior years, or is this a different format?
This is the same format in prior years. The terms of reference and policies do allow every 3 years to have an in-depth review, but this isn't a year to rehaul.
Great,
Right,
thank you.
okay.
Yeah.
Any other questions?
Nope.
No, good. Thank you for clarifying that. It's a good idea.
Great. We
Okay,
can move to
go for
the
it.
timeline.
Yes.
And I'll do a quick overview of that, the charts coming through displaying on the screen. So today initiates the process with the committee recommendations on the tool and the timeline. So we'll see that the recommendations will go to the full board on December 2nd. The evaluation tool and the executive director's self-assessment will be administered to the board and the senior leadership in January. The board secretary, myself, will analyze those results, prepare the report, which would then go to the committee first for review in February of 2025, and then to the full board for review and final approval in March 2025. And the one note is that in past years, board members have completed the evaluation at the end of December, which butts right up against all of your training deadlines. So the recommendation this year is to have the year close, give everyone a break through that late December holiday season, and then focus the evaluation completion at the end of January, which would still keep on track for the final review in March. Also, the final review of executive director before retirement.
Okay.
So with that, I can take any notes on changes or edits to the timeline or questions.
Questions, comments? No. And I suspect if anybody thinks of anything in the meantime, they can email you and let you know.
Yes, and just like with other items today, this will be presented at the full board meeting next week, and more
Right.
edits or changes from the full board can be expressed then too.
Okay, that sounds good. Is there anything else? Thank you. Okay, and I'm looking at the timeline here. Okay, good, into 2025. Okay,
I'm going to move back over so we can take a motion and
I was
go
just
through.
gonna say, all right. See what else we need to do.
I move that we initiate the public employee evaluation as SFHSS Executive Director for 2024.
Second.
It's been moved and seconded to initiate the evaluation for the Health Service Board Director, Executive Director for 2024. Is there any further comment or questions? Seeing none, let's call for the vote. Or no, public comment, excuse me. I always forget that, and I apologize. I don't mean to. I just think we've heard everything, but maybe not. Public comment, please.
Public comment is now open. For those watching on WebEx, please enter in the access ID and the webinar passcode and press *3 to be added to the public comment queue. For those watching the meeting, please raise your hand on WebEx and to be placed in the public comment queue to speak. We'll begin with any in-person public comment. No one has approached the podium, so we'll move to our moderator to notify us of any callers in the public comment queue at this time.
Board Secretary, there are 5 callers on the phone line. 0 callers have entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed.
Okay,
And we can take a roll call.
now we can take the roll call vote. Absolutely. Thank you.
A roll call vote starting with Chair Zamansky,
Aye.
Commissioner Howe,
Aye.
and Commissioner Wilson.
Aye.
A unanimous vote.
Sounds good. Okay, so we have now concluded item number 6. Just want to make sure there's nothing left over. Okay, let's move on to item number 7.
Agenda item number 7, initiate the annual Health Service Board self-evaluation. This is an action item and will be presented by the Board Secretary, Holly Lopez. I'll be moving to the podium to present.
Thank you. You get to do all the fun stuff.
So Holly Lopez, Board Secretary for the Health Service Board. The Health Service Board terms of reference and policies outlined for the Governance Committee to coordinate the Health Service Board self-evaluation every year. And I become before the board committee to present those materials to initiate the annual board evaluation. The committee shall recommend to the full board the criteria of the performance evaluation and has the authority to approve the edits to the evaluation tool and timeline to administer the evaluation. So the committee today will review that evaluation tool and implementation timeline, and the recommendations will be brought to the full board for final approval next week at the December 12th full board regular meeting. And as with the executive director evaluation, the board secretary, myself, will administer the approved evaluation, analyze the results, compile the data, and present a report to the committee first, and then to the full board. And I'll begin with the evaluation tool overview. And again, the reporting period is January through December 2024. There is a rating scale that ranges from strongly agree to strongly disagree. There are 24 questions for the board to self-report. The 3 sections include performance regarding governance structure and policies, a section on interactions and meeting activities, and goal setting and communication, and the board's interactions with management. There's a second section that asks the board to offer any educational topics of interest for the plan year 2025 for the health service system to schedule and administer throughout the year. And this third section asks the board members to report any self-study hours. And this section was introduced last year. The evaluation tool is anonymous. However, when board members report the self-study, they do have to self-identify so that the data is collected. And that's one section that can be discussed today if the tool needs to remain completely anonymous or if the reporting self-study hours stay included.
Okay.
If they were not to be included, it would mean a separate data collection that I would do. And then still compile it into the same report. So that is a long list of questions. I can pause here if there's any edits or changes to the self-evaluation questions.
Are there any edits?
I have one suggested edit. One is
Please.
on number 37. We'll change that to year 2025. Right now it says 2024 since it's the upcoming year. And
Good-
then for
good
the
eye.
self-study, I know we all like to be exact, and I think maybe estimate your self-study hours because, you know, it's a bit of a guess. Otherwise, you're going to spend a lot of time in the tool to try to figure out how long it really took. So I think estimate, it gets to the point. Those are my
Thank you.
suggestions.
Yeah.
So Commissioner Wilson, could you repeat the question, the first question, edit?
Yeah, number 37, we're going to change to 2025.
Mhm.
And then on number 39, instead of saying please report, please estimate how many self-study hours.
Thank you.
And the same thing on 41 would be
Okay.
estimate how many hours did you participate in conference?
Thank you. I missed the 41 part. Thank you. Okay, is there any further comments, questions?
No.
All right, then I'll move back to our timeline, which is very similar. We like to coordinate them at the same time. So the implementation timeline will be coming up on your screen, and today initiates the process where the committee will make the recommendations and those edits, which will then be shared at the full board meeting next week on December 12th for full board approval. The evaluation tool will be administered in January of 2025. The board secretary, myself, will analyze those results and prepare a report that which the committee will review first and recommend in February of 2025. And then the full board will review and approve that report in March of 2025. And the same recommendation comes in at the timeline. So in past years, this was administered at the end of December, and we're looking to close out this year, give the board a break, and then refocus and complete it in the end of January 2025.
Okay.
So with that, are there any questions or changes to the timeline?
I appreciate you moving it to January because I know that towards the end of December, you were herding a lot of cats trying to get us to finish things. So thank you.
Yeah.
Good description. Thank
Yes.
you. Yes. Appreciate that. Okay.
So thank you. I'll take those 3 edit suggestions and we'll bring those to the full board next week.
Sounds good. Thank you.
And I'll move back for
There's nothing
motion and public comment.
further. Okay, so, and what did I just do with? Okay, we're on number 7, right?
Yeah.
I flipped over and then forgot to mark it. Okay. Great. Do we have to take a vote on this?
We'll take the motion first
The
and
motion
then
first?
public comment and then vote.
Okay, I'll entertain the motion.
Sure, I'll make a motion to initiate the annual Health Service Board self-evaluation beginning in 2025 for the 2024 year.
Second.
Okay, it's been moved and properly seconded. Is there further discussion, comment?
I can open public
Seeing
comment.
none, let's look at public comment.
Public comment is now open. Anyone who's joining on the phone line can press *3 to enter the public comment queue. And for those watching on the WebEx, please raise your hand, the raise hand icon to enter the queue to speak. We'll begin with any in-person public comment. No one has approached the podium.
Right.
We'll move to our remote public comment, and our moderator will notify us of any callers in the public comment queue at this time.
Board Secretary, we have 6 callers on the phone line. 0 callers have entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed.
Okay, it's nice to know we've picked up a few more listeners, so I always appreciate that.
And I can have a roll call vote
Okay, let's go forward here.
with Chair Zavansky,
Aye.
Commissioner Howe,
Aye.
and Commissioner Wilson.
Aye.
A unanimous vote.
Good. Oh, we're a boring group. That's all right. It is expedient, so I appreciate that. Okay, that's it, I guess.
Agenda item number 8 is adjourned.
Done, yeah, which is adjournment. Oh. Our meeting is now adjourned. Thank
Adjournment
you all
at
for your time and your efforts and your energy and getting here.
adjournment at
this-
9:49 a.m.
Was this for me? Yeah. Oh, I just saw it. I was like, oh. Oh, sorry, I looked on this. Yeah. Yeah, reading these track changes on paper is much friendlier on the eyes.
I was always looking to see how many.
Yeah.
Oh, that's fine. Yeah.
Oh,
It's like, I just picked it up. I didn't pick it up on the screen. It's it's unsubstantial. It's on the cafeteria plan.
oh,
Page 7.